Hello and welcome to Meera's Menopause podcast. Today's episode is going to be something actually that I'm always excited about all my episodes. I say that, and I have to think about some other wording to use. But I am particularly keen today to learn a little bit more about this topic and have a conversation around it because it is something that is not talked about at all. Our sexual health, vaginal health, and a kind of emotional disconnect sometimes that happens with all of that. These are all things that are taboo. They're all things that are brushed under the carpet. It really doesn't seem to matter about culture, ethnicity. It really just seems to be across the board with everyone. So today I am joined by Dr. Angela Wright, and I'm so delighted to have her on the podcast. And Angela, welcome to the podcast. Thank you for joining us today.
Thank you for having me.
We've had conversations before, haven't we? Because you are part of. Well, you're going to tell us. You're going to tell us a little bit about yourself, please, and your company and the work that you do.
Yeah, so I'm a GP, I'm a BMS menopause specialist, and I'm a clinical sexologist, I presume is why I'm here today, because I can put it in that context, which means I'm trained in psychosexual therapy and sexual medicine. So the kind, like you said, the mind, body, the disconnect, all of that kind of stuff it's more than just hormones at this point. And I work in the NHS in East Yorkshire, around Hull. I work as part of Spice Per Health, which is online, where we do menopause and sexology. And I work at the Portland with Miss Claire Mellon and Associates. I kind of spread myself across the week in different places.
Yeah, it sounds amazing, and it's wonderful that you're doing such good work and actually supporting probably so many women and men, presumably, and couples, I would imagine as well, because it is very much kind of. And I suppose that's kind of where I'd like to start, really, because it's quite often that people will start to, if intimacy within the relationship changes, quite often it is one partner or the other that seems to, it's a blame game, or there's something wrong with me. And I think the first question for me is, and possibly for people who are listening who may want to know how does this all work? How do you start this conversation? Where does it all begin? Where do people go to, whether you're male or female, to reach out for help when things have changed in your relationship?
I mean, it's a good question, because what we know from the figures is that people don't. Actually, they just hang on to it, and then it causes disconnect. It can be really lonely if your partner's, suddenly something changes and they withdraw from intimacy and you don't know why. Then you can start to, most of us think it's us, like we have that kind of instinctive, well, it must be something I'm doing, I'm not attractive anymore, something's altered, maybe someone else is in the relationship. So but the problem, and the data tells us that actually, even though problems are really common, like 50% of men and women will have had a problem in the last 12 months with sex, about 1 in 5, 1 in 6 will actually go and do something about it. So we're not very literate to talk about it. We don't have the language to name what it is that's wrong. Even when we do go and see somebody, we don't know how to describe it properly. And if you go and see your GP, I was never trained. They're not really trained in this. So they often want to help, but kind of flounder and don't really know what to say. So if you're lucky enough to find your way towards, an accredited therapist, or to see a sexologist, or see somebody that's trained in this, you get an unusual kind of bit of training to deal with. But most people will see a gynae, see their GP, and it's potluck as to whether somebody is literate and knows what to do beyond the basics. I mean, the hormones are, we're getting to be more aware about that, but there's still lots of barriers for people.
Yeah, it is. It does feel like, I'm thinking about myself, I wouldn't know where to go. I don't even think I'd go to my GP. I think, it's not the first place I would reach out to. So it is a bit of this, it's a bit of this kind of grey area about where do I go to seek the help? And hopefully we'll kind of find out a bit more about where you are and where people can contact you at the end of the episode. But I was just sort of thinking as well while you was sort of talking there, that, and also about all the qualifications that you have, and I was thinking, wow, that's a really broad education and knowledge base for something that people would just associate with having sex. But it's just so much more than that, isn't it? It's just when that part of your relationship and the intimacy, and I suppose it doesn't need to even involve sexual intercourse, but the intimacy part of the relationship starts to deteriorate, it has an effect on your emotional well-being, your mental well-being. It can really have an impact, can't it? And on the surroundings, on your family too.
Oh God, I mean, it's funny because people in my practice, when I was working in general practice, were kind of amused that I was training in this. Like, it's a bit niche, let's be honest.
Yeah.
But and I don't know if I really knew how relevant and how all encompassing it was when I started. Like, it's now my entire week. I
Yeah.
didn't know it was going to be like that. But when you think about sex, and it's a vital bit of aliveness for a lot of us. When you're when you're desired, when you're wanting something, when somebody wants you, when that goes well, and when there's pleasure and connection as a result of it, it is one of the great joys of being alive. And I think the reason that we don't talk about it very much is because we try to sort of protect our young people from getting into this too early, so that the conversations don't really happen. But the problem when it disappears in a relationship is it's a form of glue sometimes that keeps couples together. We don't just get pleasure from having sex. We also feel, we feel attractive, we feel wanted, we feel more safe in our relationship. We feel, sometimes it gives you that little grin as you go off to work, because you've had that little bit of play almost. And it often has a lightness and a role of play, if it's good. But again, a lot of people aren't raised to think that it's okay to demand, to want pleasure, to ask for what they want, to have the language to do that. So for a lot of people, when I see them, they haven't ever really felt they've been invited to the party all the way through their lives. It's so different for each of us what it means and the access we get to expressing that
Yeah.
bit of ourselves.
And it's just very, very, as you said, it's very taboo. It's not talked about. It's almost dirty, or it's almost something that's a secret, and it's almost something that,
We talk about it all the time,
all
like
the
in
time.
media and on, endless articles, endless stuff about it, but we don't talk about it as it really is, to feel like you're
Yeah.
falling short of that, or
Yes.
why are they all having good sex and I'm not?
Yes.
So we don't
Yeah.
talk about what it's actually like.
For us, yeah, you're right. And I think so. I mean, to add into this, there could be many reasons, I'm sure, for intimacy changing within a relationship. But one of the things that I have heard when, when I have to say this, but when women have been brave enough to be able to open up about it, and I love it when they do that, because I'm just like, wow, look, I'm so proud of you for doing that. But it will be that their their sexual desires have changed. It could be that they're having that actually having intercourse is painful. There are changes happening. To their vagina, to the vulva, to all of to kind of even to their breasts, anywhere where perhaps there are zones of pleasure that they can't, it just isn't the same for them anymore. What's going on? Like what exactly is happening when this is all going on?
I mean, if you just stick to the body-based stuff and just stick to what's happening in women's bodies, because obviously if you're in a heterosexual relationship, men are not immune to aging and hormone change. And the stats support the fact that about half of them will have a problem around the same time. So we should mention
Wow.
that, because
Okay.
the women think it's us with an expiry date and no one else,
Yes, I
which
know
is
that's an interesting point. We should go back to that for sure,
so
right?
because I say that a lot to people, and often I'll see the woman and actually the problem in the relationship is stemming from a change in desire from the male partner or something that's happening with them. So they will present themselves, fix me, I'm the problem, but they're not. But what happens with menopause is you get a change in the way that your brain receives the messages, thinks spontaneously about sex, might sort of come up with fantasy and thought, and in the way that we receive pleasure in our bodies and how we're adapted to cope with sex, so the turnover of our vaginas and vulvas, the lubrication, the nerve ending density, all of that stuff is affected, because really, Mother Nature set us up to want to have sex to help us to procreate like that. So when ovulation doesn't happen anymore, some of the energy is not sent into keeping these parts of our bodies, ready, always ready in case we get pregnant. Same with breast tissue, we get less blood flow. We can sometimes find that breasts are less sensitive. I get a lot of women saying they really loved breast play, nipple play, and then it's just joyless. So bodily changes definitely happen, but we have this idea that desire is like an appetite, like hunger, and yeah, the hormones have a big part to play in that bit of it, but our pleasure and reward, positive or negative reward from the behaviour of bothering to have sex, also has a massive impact on our interest in sex. So if every time you do it, even though you didn't have that spontaneous feeling that you wanted to, but you do it, it's pleasurable, you're more likely to respond to an initiation because the memory is it was worth doing it. I got something good out of this. I felt better. But if you get a UTI, if it hurts, if you don't get aroused, if the pleasure, I had a woman in clinic this week said, pleasure used to be up there, it's now here. It's just not as much fun. It's not, and men, when they have sex, use the entirety of their, physical part that feels sensation. It's all involved.
Yeah.
Already for female bodies in heterosexual sex, actually, it takes effort to stimulate as quite as we need to be stimulated, right? And it takes time.
Yeah.
So men often will continue to bother, even when everything else is diminishing and they're knackered and they're tired and everything, because it's quite easy for many when it's working to get a hit of pleasure. But for us, it's an effort sometimes to get it, particularly when bodies change. So, you might choose the cheesecake and the cup of tea, or choose the early night or scrolling or something else instead to get the same hit of pleasure and connection. So, yeah.
Oh gosh, oh dear, right, yes. So that's why there is all that scrolling and doom scrolling going on, I think, and the cheesecake being eaten.
Yeah.
I mean, it's interesting you say that, and then going back to what you said, because there's a lot there that I just want to have a chat about in a minute. But you also spoke about men, and the fact that it's around the same time. I mean, that's just like it's a kind of recipe for disaster in a way, isn't it?
It's being named more often in sexological circles as couple pause. And actually, even if you're in a same-sex relationship, you're often with somebody in the same ballpark who might be going through menopause at the same time. So if you're having sex as part, because there is solo sex, but if you're in a relationship and sex is part of that relationship, it isn't just what's happening in your body that's relevant. So for guys, the figures are roughly sort of 40% of men over 40 may have lowering testosterone. Now, that doesn't mean they need it replacing or that it's causing a problem. That percentage is way smaller, but sometimes that can be having an impact on how they're feeling. Many men will be developing erectile dysfunction. The figures go up as they age because of, the same things that cause diabetes and heart disease diminish men's blood flow and nerve sensitivity in their penile tissue, so they might lose their morning erections. Big marker of problems with health, actually. If you lose morning erections in your 40s, you've got, within 3 to 5 years, good odds of developing heart disease. But we don't talk, because we don't talk about it, and because it's uncomfortable in a relationship to be vulnerable enough to say, yeah, I'm not sure that I'm going to get aroused if I bother to have sex. I'm not sure that my erection's going to last. I'm not sure what's happening with my body. It becomes the elephant in the room, and everyone steps around it and tries not to say no because that feels awful to be rejecting. So the need to talk about this, not just because of quality of life, but actually about health and other outcomes, is huge.
Yeah. Wow, I didn't know that at all. That really has. That's just opened my eyes. That's quite an amazing statistic as well. And we aren't talking about it at all. It isn't spoken about. I mean, just literally isn't spoken about. I mean, I haven't even read anything about that either. Normally everything comes out, big bold headlines.
There's chatter in the bro science. There's a lot of chatter around testosterone replacement and guys in gyms and so on. There is chatter in my world that you can see is picking up, but and it's not always, heart disease that's the cause of loss of erections, but loss of morning erections, particularly for guys in their 40s, 40, 50-fold increased chance of there being a heart problem that's going to come up in years to come. So I suppose my point is, can we stop talking about, sex in magazines and films and telly and all these kind of sexy ways? Actually, just being a bit more factual about the fact that it can be a marker for health, and it's a real marker of quality of life and relationship satisfaction. And the sad thing about the fact that we don't talk about it is, a lot of the time it isn't actually that tricky to do something to support people in it. We just have to get them in to have a conversation.
Yeah. And I suppose that kind of leads me, obviously that then you've got that double whammy in a relationship. Like you said, whether it's heterosexual or not, it's that double whammy of possibly both partners feeling some kind of disconnect, some kind of, there's a problem, there's something happening. And again, not quite sure what that is, How do I go about it? What do I do? So what do they do? What is there something that can help? Because on a really my experience, my own personal experience, was the introduction of vaginal estrogen for me was, it was just completely kind of revolutionary in a way, because you just don't realize that there are so many changes going on. And this is despite me knowing lots of stuff and reading lots of stuff and supporting lots of women. But just something as simple, and I say it in that way because it really is. It's a simple thing to use to get a really impactful change. But again, that's not being spoken about. But that's just, I don't know whether that's an option, but what options are available for couples?
Yeah, I mean,
physical, and mental, if I could just ask for both, because there's both sort of sides.
So I've got into the habit of saying, look, it's a jigsaw puzzle. So most people come in and tell me that libido is their problem. Like, that's the thing that's the language we have, isn't it? I don't want to have sex. But underneath that is, well, is it because it's painful? Is it because it's not pleasurable? Is it because it makes you feel bad about yourself? Is it because you're knackered? Are you distracted and anxious and in your head and burnt out? And for God's sake, if anybody else wants something from me, I'm going to explode. And is that so there is that kind of, it really is different for everyone that comes in. But I start with body. If I've got somebody who's going through menopause, I would start with the body-based things and just lay the groundwork, so I know that their body's going to work as well as it possibly can, and then we go down the mind and the relationship and everything else route. So vaginal and vulval estrogen, so not just inside, because God, not all of our pleasure lies with penetration, does it? A lot of it's on the outside. So estrogen inside, estrogen as a cream on the outside. That isn't just for people who can have systemic HRT. If you've got a breast cancer history, it is increasingly acceptable that we just go ahead and give it in those circumstances too. There's some bits you need to kind of caveat with around aromatase inhibitors, and not every oncologist, is as supportive, but there are guidelines to support around that. So vaginal estrogen, what that will do is allow the cells to go back to turning over more quickly, which is really important for us to withstand the friction and the sort of the cellular micro trauma of enjoying sex. You've got to kind of rub things, so that can cause problems. It helps you heal from that. It brings back more blood supply to the area, so you lubricate more easily. So again, it reduces friction, increases pleasure, helps the density and sensitivity of the nerve endings. So touch has a bigger impact, so you're more likely to get aroused and get a reward. Protects bladder, so you don't get infections as easily. You're more continent. You won't leak if you get aroused. Women get fearful of leaking with certain touch or with climax, and you've got to make sure that their bladder feels strong. And it invites the right biome back into the body again. So the bugs that live in us to support our health in vaginas and bladders does all of that. So really important, as well as massage and emollients and other stuff. Systemically, if someone's open to HRT and there's a good reason to give it, they're symptomatic and they want it, and there's no reason to avoid it. If you give estrogen back, then you help with the rest of the body in terms of minimizing distracting symptoms. So, you start kissing, you don't want a hot flush to come up, and that does, as you get aroused, a lot of women will feel a flush come on, which is distracting for them. So get them to sleep better, get their joints moving more easily, get them to be less stressed and hot flushes and so on. And it primes the brain for responding to external cues a little bit better. So I had a woman in who told me, even if Keanu Reeves was in the room naked, I won't give her monkeys. And that's kind of, there's a lot of reasons for that, but if your brain isn't primed to respond to the cues, it makes it harder. And then there's testosterone, which does that even more. We don't quite know the ins and outs of which hormone is more important in brain, actually, in terms of fantasy and responding, but testosterone is important in that process. It's important for clitoral health and blood flow as well, so it keeps the systemic testosterone supports genital health, because the androgens are important too. It helps with some vulval pain conditions. So you're just, I suppose, if you look at it from a nature perspective, our hormones were at their highest levels in our menstrual cycle when we were ovulating. There's got to be a reason that was the case, and so we bring some of them back, and that helps. And that's the body bit.
Okay. It sounds like there are lots of options. It sounds like there's a lot that we can do, and a lot of support we can get to try and get our body working.
Well, this is it, and that's your baseline, right? That just takes you back to being like you were when you were 30, which doesn't
Yeah.
mean that was a period of immense horniness and having lots
No,
of sex, does it? So the body
no,
is only one little
this is
bit.
it. This is it. Um, and I suppose then it's the emotional side and like you said, exactly that, you don't have the desire to, regardless of what's going on, to have that intimacy. So do people, I mean, I suppose then from there is there, because it almost sounds like when you were speaking before and you were talking about the brain and how it almost sounds like you and the reward, it sounds like something you could relearn or re-explore or kind of create new connections and memories or
Totally. So there's a bit of so there's this liking, needing, wanting that comes in with sex and anything appetitive. Like cheesecake is a good example. Like, how did you ever know you liked it? You had to see, you try it to get reward. So we have an innate bit of our sex drive, which is there's bits that are reflexive. There are bits that happen spontaneously because of how our bodies just flux and change with hormones and things. And then there's lots of learned behaviours, almost like, ringing the bell for Pavlov's dog and then you
yeah,
salivate. There's a lot of
yeah,
that side to sex. And there's something called the sexual tipping point. So there's a theory that each of us has a different point where the brakes and accelerators towards having sex and the bits that inhibit flip the balance. So at different times in our lives, we might be more towards foot down on the accelerator. We're really thinking about it. Other times we're not. So to your point, Alec, what can you do? If you can create two things in my view. One is the context where you have the energy to think about it. So your basic, like almost in Maslow's hierarchy, your basic needs are met. You are rested, you are fed, you've thought your own thoughts through, you've had an hour with nobody asking you for anything, so you meet your own needs first, be selfish for the team. That's kind of the critical bit there. Assuming you've done the hormonal bit, we're on this bit. And then the other thing is make it as rewarding as possible. Make it as pleasurable as whatever that looks like for you, because it's different for everyone. And not just rewarding in terms of physical pleasure, rewarding in terms of connectedness, emotional connection, all the other bits that you might need, the creativity, all of it. And then you're likely to wire yourselves towards going, well, the last time I did that was good. I mean, it's like when you go to the gym. I mean, how often do you want to get up and go? But how many of us who exercise regularly drag themselves out because they know it's type B fun? At the end of it, you're going to go, I'm glad I did that.
yeah,
I feel better for that. I feel better that I'm the kind of person that does that.
yeah,
So the rewards aren't always in the moment for everybody. Orgasms are great, pleasure is great, but sometimes the rewards are, we were so connected, me and my partner, we felt like we were back to something of our old selves. We held hands the rest of the evening and we felt, we were more, and the science supports that couples that don't have sex stop holding hands, stop touching, stop the casual moving the hair out of the way or taking the crumb off the cheek. You don't touch actually, and you get it's isolating and lonely making. So I think you've got to be sort of granular and almost a bit forensic in kind of going, when it was good, when everything worked well for me, what was it that gave me the context and the headspace and the interest and everything else? And one fact I learned fairly recently that I think is really relevant is, it's other time of your life, but women after having a baby, sex tends to derail. It normally is back on track by 12 months, but most women who have a solo sex and masturbation habit will get back to that by 4 or 5 months out from having a baby. They won't get back to having partnered sex. And doesn't that say a lot?
yeah,
In terms of the complication of having to
yeah,
bring someone else's needs into it, someone
yeah,
else's. I just think we have to be
yeah,
aware of
yeah.
that.
Because you are, you're having to deal with the baby, you're having to deal with the baby's needs and
You want
everything
any
else
more
that
sex?
goes.
You don't
It's
want more
just
sex.
easier. It's so much less complicated, I suppose. I think that's the thing. Is that complication, and I suppose if there is so much going on, as you said, in this whole, there's I think with menopause and perimenopause, I think in particular, there's just so much going on, and it seems to be happening more and more to women in the sense, I mean, in stage of life for women when they are either at the peak of their career or they've got their children or they've got, they're looking after their own parents, as well as young children. It just almost feels like there's, as you said, there's so much going on that that's, as you said, your priority list. That's the way down on the priority list, because that's just.
We're burnt out, there's something around caring responsibility. So I think we know from the research that when we're in that caring part of ourselves, we're nurturing, we're raising children, we're looking after things, we have that responsibility of making sure that other people's needs are being met. And without being really stereotypical, in some households, in some heterosexual relationships, often you feel like you're caring for your partner as well, looking after their emotional needs, managing their anxiety. And, a lot of us will do a lot of that stuff. But we also know that when you're in that part of your brain, you're not in the bit that easily eroticizes. So I think one of the things that happens is, you're busy, you're distracted, you're very needed to the point where you almost trip round that drama triangle and stop wanting to rescue people and start getting quite cross that people need you. And because sex doesn't always feel like taking for women, it often feels like giving. You do get something, but it isn't quite as easy. Back to that kind of, is it easier to just play on your own than it is to invite someone else? And if you wanted an orgasm, quickest way would be, reach into the drawer and get the toy out, wouldn't it?
Exactly.
So there has to be something that's better. You have to make it so that sex is getting. And in order to do that, it has to genuinely meet your needs. And I think for a lot of women in the years running up to menopause, after the years where you got together with your partner and you were full of creativity and it was interesting, and it becomes more like maintenance sex, sometimes you get the bells and whistles out, but for a lot of people it is less exciting for the female partner perhaps. And there's evidence that women probably need more excitement actually than men. They're more likely to not settle to monogamy because they kind of need the extra bells and whistles, but they put up with it societally. We're told to kind of just put up with it, this is your lot. I think you have to be very honest about, well, what would be pleasurable for you, what would be enjoyable for you, what would the context need. If you sent me to the Maldives for 2 weeks and I did nothing but rest for the first week and look after myself, and then you sent me Bradley Cooper and all he wanted to do was do what I wanted him to do with no expectations, fine. Maybe the big day's there. And I'll put that to people and they'll be like, well, if you just gave me a massage, if I just had to have this and I didn't have to, I could be really selfish, and it was going to feel pleasurable.
Yeah.
It would be there.
Yeah, you're right. It is such a complicated
Very much.
scenario, or should I say, it can be. It can be. It isn't for everybody. You have to say, I know a lot of people who, for them, their relationships have blossomed, and their intimacy has grown, and they've just got a lot more confident in themselves with each other, and that's been really lovely. But equally, I also have friends where it's just completely broken down. Even despite actually the intimacy and the sex potentially being okay, so that's also, so just, I think Angela, for me, what's coming across, and I think again, menopause in itself is complicated. It just sounds like it's a very complex. You just can't pigeonhole anything. It's all connected to everything, totally. And in a way, you can't just. Well, you can't suppress one bit because the other bit kind of comes up. You can't push that bit down because the other bit comes up. And it sounds like the solution, if there is one, or I mean, there should hopefully be for most people, I think, if they are able to reach out. But I think that's part of it, right? The solution is part of understanding and recognizing that there are physical and psychological changes, emotional changes happening to us. But equally, that's impacting the person that we are with, our partner at that point. And also, therefore, the solution needs to the solution needs to be multifaceted. It needs to be dealing with the actual body, as you've said, for which there are things that we can do, right? And then, again, working on that kind of psychological side of stuff, which again, there sounds like there's support and help out there. So with something like cognitive behavioral therapy, I'm just thinking if somebody's reaching out to someone and thinking, I need to go and see a therapist or a counselor or whatever, Is that something that can help?
Yeah, I mean, the thing I never sort of grasped before I did any training was like quite how many different types of therapy there are. So cognitive behavioural therapy is just one type of
Yeah,
therapy, a bit more accessible on the NHS actually,
yeah.
because it works quite well in short sessions. And the idea with that is that you try to support new behaviours. You try to break down thinking processes and then gently support a new behaviour, test it out,
Mm,
and so hopefully you change behaviour. And yeah, so I mean, if you had pain previously with sex, then a CBT type approach to that, where you are guided to try things and supported in that process might help. But it's different for everybody. Sometimes you need talking based therapy, literally just space to figure out what might be going on and what might be driving you. And that, I mean, I can't tell you how many women, you'll give them a prescription, for example, they'll come back in 3 months and they won't have even opened the box, or you'll talk
yeah,
about something, they'll come back and they won't do it. So sometimes we're not even aware of our own blocks and
no,
barriers. So you need
yeah.
to, peel back and figure out. Sometimes it's very body based. The more work I do in this area, the more I realise that often we don't need to work with heads, we need to work with bodies, and we store our trauma and our previous, negative experiences in our bodies, particularly if you've had, trauma history, sexual violence, illness, cancer, surgery, some of those things, you don't even know why your nervous system is reacting a certain way to something, but it is.
Mm,
So yoga,
mm,
exercise, breath work, mindfulness, those kind of things can be more
mm.
helpful. Sometimes you need trauma therapy. I'm doing a couple of different modalities of trauma training this year, because again, the more I've done this work, the more I've realised that a lot of this is underpinned by that nervous system switch that happens when
Yeah.
you've been exposed to trauma. So EMDR and sort of the somatic therapies can sometimes be useful. And I suppose it
Mm,
sounds really bloody complicated, but like you say, there are people that have good sex at this stage. There are loads of people that go on to have great relationships, and
yeah.
everyone's sex life is different. And some people are in a great new relationship, having really good sex, they hit menopause, physically it changes, you sort that out for them, they're back on, it's fine. Sometimes it's a tipping point because this stuff has just been grumbling away for a long time.
Mm, yeah.
Something, it changes you from being able to just about be all right with it all
Yeah.
to just
Yeah.
about overwhelmed and can't.
Yeah. And I think ultimately for me on a personal level as well, and I think whenever I've spoken to women have been very kind of have spoken to me about their relationships, it always is where it seems to work itself out is where there's this willingness from both sides to be able to be open and listen to the other. And I think for me that was without doubt for every part of this stage of my life. The openness and the ability to be able to have those conversations, however difficult they were for me, being supported by by Harry to have those conversations was key to to it all, was key to us getting through all of that, where I'm 1 minute I'm crying, the next minute I don't know what I'm doing, next minute you kind of feeling passionate, and the next second literally you're like, what the hell are you doing, get away
Go
from me.
away.
That's it. It's like, whoa, hold on, I just literally went out of the room, came back, what happened? But yeah, no, it is. And I think that ability to be able to talk to your partner, the person that you want to be with, seems to be, and for the other person to be able to respond and receive information and not feel like you're being rejected, sounds like it's kind of really almost, it's key. It sounds really key to me, people to
Oh,
work through
massively.
together.
And I think, and also like communicating what you intend. So, the partner that can sometimes be pestering for sex, actually sometimes what the intention is I still find you desirable. You keep telling me you feel fat, old, ugly. I'm telling you, no, you're hot to me. I want you. And are we misinterpreting, or are they a pain in the backside? They're not listening to
Yeah,
you. They're not hearing what you're saying,
yeah,
or is it about, I feel rejected, I don't feel wanted? You don't know what the message is that you're
no,
being sent. And I think that's the same in the other direction. When you turn over and you reject an advance, often that isn't aggressive. It's actually about, I don't find myself desirable. I can't imagine myself as sexy right now, and I feel ashamed of myself, the feeling. And so you're actually sending out a message of rejection, but you're not rejecting the other. You're
No.
actually just wanting to sort of crawl in a hole, and you just feel vulnerable.
Yeah.
So to open up a conversation that explores what is actually going on, it debunks all of those myths, and it makes everything a lot safer. So it's really, really hard, because none
Yeah.
of us are taught the
No.
language. None of us are taught that bodies change, like inevitably. Female bodies in particular are in flux loads in our lives, and we all want to sort of, I was having a conversation with someone today, we want to maintain control and pretend it's not happening that way. And
Yeah.
something about being able to show up, the thing about communication is it makes it safe to show up as you are on that day, in that moment,
Yeah.
congruently.
Yeah.
And sex doesn't. Sex it requires safety for it to be good. So
Yes.
our nervous system, most people know, you have the sort of fight, flight, sympathetic side for danger and survival, and you have this parasympathetic side, which is all about rest and digest. Sex and arousal have to be in parasympathetic. That's where the nerves are stimulated to create the erection, to create the arousal. So when we're really in fight flight all the time, so women after cancer, they've had 2 years of being in survival mode, or if you're running around looking after kids, aging parents, work's a car crash, everyone's having a go at you, you are always in sympathetic. So you're not supposed to feel arousal in that situation, because your body doesn't think you're safe to procreate. So safe conversations, safe situations, bodily safety, contextual stuff where you make your life a safer place is all kind of good for foreplay. Like, it's all the basics that need to be there for you to be able to access that part of yourself again.
Yeah. I'm sure people listening, I'm sure the listeners will be going, oh my God, yeah, that sounds like me, going, here, there, everywhere, things all over the place. And I think a lot of women will be able to. Yeah.
This idea that you just need to and you do. It's useful to get testosterone for many people, and it's a shame it's gatekept quite so much. But part of the counter argument is, if you use it and it doesn't work, you can feel really crap, because you're like, well, now and it's understanding that is just going to look after body. If everything else is still not right, you're still not going to change in terms of how much you exactly.
No. I think that is definitely coming across really loudly, and very, very clearly. I think that it is a multi kind of faceted thing that we have to look at in order to deal with it. I suppose my kind of final question, actually, because we've just covered so much, and then my brain is kind of going, trying to sift through it all. It's been brilliant, but I suppose. I wonder, and do you know if this is, going to happen? Is it on the cards? It's amazing how, as you talked about earlier, about there are certain markers that help indicate long-term health. There is so much being said and spoken about now about osteoporosis and bone health at the moment. It's just everywhere. Also markers for kind of cardiovascular health, as you said, and diabetes and all of that in relation to our sexual relationships, in relation to our sexual health. Is there anything that you think will be put out there? Is there something that's coming? Will people be talking about this? Is it going to get the spotlight that it deserves? Quite from what I can hear from you, there's a lot we can learn from understanding this a lot more. But do you think that's coming? Do you think there's anything out there that's sort of indicating that it's going to stop? We're going to be able to start talking about this a lot more fluidly.
We sort of are. I mean, again, we're all in our own little bubbles, aren't they? So, I have enough work, because people want to talk about this more. So that, I mean that in terms of articles and podcasts and come and write a chapter, and so the demand for this information is getting higher. You read about it more, and I still roll my eyes at a lot of the articles and the way that it's approached, because it's still done in a very 7 top tips for orgasm, and you know, does your partner want someone else, and that kind of stuff, and it isn't gentle enough or as based in reality as I'd like it to be. But and tech companies are starting to climb over the women's health area and the men's health area. They want to get into sexual health. So there's an appetite and an awareness that there's a gap here. So I think it is going to change. But, you know, it's not just the men who lose their morning erections that have cardiovascular risk or diabetic risk. Women get morning erections. You know, women wake up with arousal in their younger years, and they know that they're kind of in the mood. It's part of how sometimes we feel libido, and that's part of what goes when you think you don't feel it anymore. So it's a marker for you regardless of gender. And I think we're still 20 years more away from that being an easy question to ask in a GP surgery that doesn't feel awkward, that we can talk about as if it's any other body part. You know, are your genitals working as well as they were? You know, they're just separating that from desire, just that kind of, you know.
Absolutely, because it's a part of our body. Yeah, and it is a part of our body. I know Dr. Aziza Cisse, you know, she talks openly and campaigns openly about, you know, we've got to use the right terminology, because, you know, you call an arm, a leg, a leg. Why would you not call a vagina, or a penis a penis? It's as simple as that, you know. Angela, it has been such a pleasure. Thank you for your time today. Just before we go, and I ask you to share your details, I'm just going to say thank you to the listeners for listening today. And if you have enjoyed the episode, well, as much as I have, really, please do let me know. Message me. You can always, I love hearing back from you. But also, please like, share, subscribe, you know, share it with friends and family. Share it with your partners, share it with your, you know, your children. It's or your mums, or whoever, because it is such an. This episode is. They're all important, but this is, you know, something that's just so difficult to talk about for so many people. So actually, just saying, why don't you have a listen to that episode? It can sometimes break the taboo. And also just let me know if there's any other topics that you would like to hear about. But just to finish off, Angela, thank you so much for joining us. But please tell us where people can find you. If they need to get in touch, and also know more about the work you do.
Thank you. I think you're going to put on my sort of social handles, so I'll leave those bits alone. But I'm online. If you want to see me online, I'm at www.spicedpearhealth.co.uk. And if you want an in-person appointment, I do online with Claire Mellon, but I'm in person at the Portland with Miss Claire Mellon and Associates. So I think that's www.clairemellon.co.uk. And you can see me through that. I'm on the NHS as well, actually, still in North Yorkshire and in East Yorkshire. So if you're in that area, you can get me that way.
Fantastic. Angela, thank you so much for joining me and taking the time to speak to us today.
Absolute pleasure. Thank you.